Hi guys, I am Dr. Naisha Bonnet, the nurse doc tutor. This channel is dedicated to helping you pass nursing school. Yes, you can pass nursing school, and I am here to help you. So today's lesson will be on cystic fibrosis. This is a pediatric condition, so if you are in pediatrics, guess what? You're in for a treat. So I break down this disease process to help you make it simpler. If you are not in pediatrics, but you are in a med-surg class, I show you how to break down a disease process. And this method that I use, you can use it for all topics. So if this is your first time here, I want to thank you for stopping by my channel. Invite some other nursing students. Bring everybody on in to help you all gain a better understanding of this topic. So let's get into it. So first we're going to talk about how to break down a disease process. So what is a disease process? Such as like hypertension, asthma, all those different types. You know what disease processes are. So first we're going to start off with the pathophysiology of it. What is happening in the body? You need to refer to your anatomy and physiology notes, okay? Then we're going to discuss your diagnostic procedures. How is this disease diagnosed? Also the lab values that go with it. So as we talked about in the last lesson, it's not good to just know your lab values, but it's way more important to know what the lab values represent, if they're high or if they're low. Risk factors. These are high-risk populations. What puts someone at risk for this disease? So as you're going to learn how I work and how I teach, is we always want to know the how and the why. I'm constantly asking, why is this happening, or how could this happen? So those are two good questions to just keep in mind. Clinical manifestations. How does the patient look? So you'll hear me refer as, how does the patient look? That means, what are the signs and symptoms that the patient is presenting? Complications. What are some complications that can arise from this disease if it's not treated? Nursing interventions. What are you going to do as a nurse, and what can you expect the doctors to order? All right, so let's begin with cystic fibrosis. So we need to know the pathophysiology of cystic fibrosis. How does it affect the body? So cystic fibrosis is a genetic disorder that affects the exocrine glands. So then you need to know, what is the job of our exocrine glands? The job of our exocrine glands are to produce and transfer secretions such as your mucus, your tears, your sweat, and digestive enzymes through ducts instead of the bloodstream onto your body surfaces. All right. So there is a specific gene that patients with cystic fibrosis have, and that is your CFTR gene. So this gene causes the CFTR protein to malfunction and causes the exocrine gland to not work properly, which will lead to a thick buildup of mucus in multiple body organs. So what is mucus? Mucus is supposed to be a lubricant, right? But in cystic fibrosis, mucus is now thick and sticky. When mucus used to be thin and slimy, it is now thick and sticky. So remember that when we go over the body systems. So how is cystic fibrosis diagnosed? It is diagnosed, there are 4 tests over there, but the one that we're going to focus on is our sweat test. So this test is a golden standard in CF diagnosis and measures the level of chloride in your sweat, which is abnormally high in this patient population. So later on, we're going to talk about sweat and how that works in the patient, and how this and why this test will actually be abnormal for this patient. I just don't want to get ahead of myself, but that is how it's diagnosed between one of these four tests. All right, so let's go on to the next. So with cystic fibrosis, it affects many body organs. So what we're going to do in today's lesson is break it up into systems. So first we're going to start with respiratory. So in these patients with cystic fibrosis causes bronchial obstruction. So let's look at the demonstration we have over here. the diagram we have over here. So this is our healthy airway, and this is our bronchioles, right? So we see how this bronchiole is clear. So guess what? Air is able to flow as it needs to. You see how wide it is? And air is able to go where it needs to go. Now let's look at our other picture on the side of it, our bronchioles. We see we have all this brown stuff. This is mucus. And as you can see, it is obstructing the airway. It's obstructing the bronchioles. So guess what? Airway then is narrow. You see how skinnier this line is compared over here? So this patient is going to have a hard time breathing. This patient, you may see wheezing, because guess what? They're trying to get out as much oxygen as they can. They may suffer from cyanosis. Why? Because not enough airflow and not enough oxygen is coming through. So these patients may also have emphysema, which is damage to the lung tissues due to reconstruction and remodeling of our airways. So it then starts to cause a structural damage, and then pneumonia. So as all this mucus just sits there, because it's not breaking up without any medicine or anything, right? It's just sitting there. And with cystic fibrosis, we have this extra secretion of our mucus, and our mucus is thicker than normal. It's more sticky than normal. Guess what? It gets stuck in the bronchioles, and with it actually sitting there, that can cause pneumonia, which is nothing but an infection. So and that's a great spot for bacteria to start to grow, and it leads to pneumonia. But this also can just start to destroy your tissues. So you want to be able to recognize when a patient is experiencing respiratory symptoms from cystic fibrosis. That is the biggest system that it affects, but guess what? It affects other systems as well. So let's move on to the next one. So let's talk about our liver. The job of our liver is to remove waste from the body, right? So, and it's removed through our bile ducts right here. So this is our bile duct right here. And so with cystic fibrosis, there is a blockage of the drainage of bile out the liver via the ducts and the gallbladder. And with these patients with cystic fibrosis, there becomes a buildup and blockage of the ducts. This prevents bile from leaving, causing inflammation in that area, inflammation in the liver. So this inflammation in the liver can lead to portal hypertension. There will start to be scarring of the liver, which is cirrhosis, which can cause an increased pressure in our portal veins, which leads to enlargement blood vessels and enlargement of our spleen. So we can see portal hypertension and liver fibrosis in patients with CF. So now let's discuss the GI system. So patients with CF, they have blocked and clogged tubes, which lead in and out of the pancreas, the liver, and the intestines. And it slows the movements that help food move throughout the body. So this slow movement of body waste through the intestines may cause blockages. These blockages make it difficult for the body to get the nutrients it needs. And this patient may complain of pain, nausea, and vomiting, and even acid reflux. So cystic fibrosis prevents the body from processing foods and turning that food into nutrients. So these patients will need to have a high calorie, high protein diet. Why? Because the body is not processing foods and turning it into nutrients as it should. So what that patient could get in one serving, it may take them 2 servings. So we want to make sure that the patient and their family understands that that patient needs to be on a high calorie, high protein diet. And another thing to think about, these patients need more calories, because if that patient is fighting to breathe, if that patient is fighting off infections, guess what? That stuff takes calories. That stuff burns energy. So in order to get back what they may lose by coughing so much, that patient needs to increase some energy, which is calories. So let's talk about distal intestinal obstruction syndrome. So what that is what it says. In the distal part of our intestine, there is an obstruction due to the buildup of mucus, which prevents the body from breaking down and absorbing the nutrients that it needs. So steatorrhea, which is greasy, odorous stool. And the reason why the stool is described that way and looks that way, because it is a bunch of unbroken down fat. All right, so that is a hallmark sign of cystic fibrosis. So meconium ileus. So meconium is the what? The first bowel movement that comes from a newborn. So that patient needs to have that bowel movement within 2 days. Ileus means stop or blockage, right? In the ileum. So with meconium ileus, it is that patient hasn't had that first bowel movement that they need to have. So that patient may have vomiting. You may see abdominal distension in this patient, and you want to keep this in mind, because this is something big that is in newborns and is also a hallmark sign of cystic fibrosis. So let's talk about the pancreas. So in the pancreas, we have pancreatic enzymes, and these enzymes are responsible for digesting and breaking down the fats and proteins in food. All right, so in the pancreas, there then becomes a blockage, right? And with that, the pancreas then isn't able to break down these fats and proteins that they need to, which leads to those enzymes building up in the pancreas instead of reaching the digestive system, which it was supposed to. So this patient can start to see fibrosis in their pancreas, which is scarring and hardening due to the buildup of enzymes in the pancreas. Also, that patient would deal with a malabsorption issue. Why? Because that patient isn't able to absorb the nutrients that they need. So that is a big issue for our patients. So that's why we talked about in the slide before how we need to increase their stuff in their diet, right? So they also will have steatorrhea. We mentioned that. And that patient will have diabetes. Why? Because fibrosis can happen in the pancreas. That can lead to diabetes because it damages our insulin production. So you will expect to see this patient to have high blood sugar. Why? Because guess what? There is an disruption to insulin production. So insulin is not being produced to bring down their blood sugar. So what can we do in the pancreas to help the pancreas out? So a patient can still get these enzymes, right? So you're just like, oh my gosh, is this patient not going to be able to break down any food because they don't have these enzymes? No, they will take pancreatic enzymes, and it is so important for the patient to take their pancreatic enzymes, and they're going to take that before their meals, and they're going to always take that with all their meals in order to, guess what, break down that food that they're about to eat. A patient may be on insulin to help them out in their with their diabetes to bring down their blood sugar. So it is important to remember the patient needs their pancreatic enzymes, the high protein, high calorie diet, and also they will be on supplements as well, vitamin supplements. I remember as DEAK. All right, so let's move on. So let's talk about the skin. So we know that our exocrine glands, they produce and they transfer sweat as well, right? So we know that we're going to have some sweat issues. So we talked about the sweat test that can be done later on. And now we're going to get into how, why, and all that stuff. So salt is carried by the skin by perspiration. Once the skin is cooled, the salts are reabsorbed into the body. In the patient with cystic fibrosis, the salt is not reabsorbed and it remains on the skin. The body has difficulty maintaining its normal internal salt levels. So this patient skin is going to taste real salty. So you may hear about a salty kiss from a baby. That is a hallmark sign as well as cystic fibrosis. Because what? Salt is supposed to be reabsorbed, but guess what? It's not being reabsorbed. Why? Because the ducts are blocked. So that salt remains on that patient's skin. So what do we also know about salt? Wherever salt is, water follows. So this patient may sweat a lot, and we want to make sure that we are looking for dehydration, that we are watching out for dehydration, and telling the parents about dehydration if that kid is in sports or things like that. So their salt regulation is not what it's supposed to be. So that is one important thing as well. So if that patient is not absorbing salt as they should, that patient should have a diet with some salt in it as well. Because why? They're not, unless it's contrary indicated due to hypertension or something like that. But that patient needs salt in their diet as well, because the salt that they have is being excreted during the sweat, but it's not being reabsorbed like it should. So what are you going to do? So with respiratory, we can do chest physiotherapy and positive expiratory pressure therapy. So the chest physical therapy, respiratory can come in and do that. And the positive expiratory pressure, they could have a little flutter machine, and that just is to help break up the secretion, loosen the secretion. So you want to make sure that you do this 1 to 2 hours after a meal, because you don't want to ruin that patient's meal, because they may have some phlegm that comes up, and that leaves a bad taste in the patient's mouth, so they may not want to eat. So you want to educate on how to prevent infections. So we know that this patient is at high risk for pneumonia, and pneumonia is an infection. So we want to make sure that that patient is washing their hands, that they're wearing a mask if they're around other sick people, especially other patients who have cystic fibrosis, and they're sick. We want to make sure that they're always protecting themselves, and just following hand hygiene, and just being clean to prevent infections. Also, you want to prevent constipation, because we talked about that gut blockages, right? So we want to prevent constipation. We can prevent constipation by taking stool softeners, by increasing fiber in our diets, by exercising, by hydration. Those are things that you want to teach your patient. Also, encourage your high-calorie and protein diet. We talked about that enough. Also, you want to monitor their blood sugar, all right? So exercise can clear secretions, so exercise is good, but you want to watch out for dehydration. So this is a list of medications that you can expect for the provider to order. Bronchodilators to dilate the bronchioles so airflow is able to come through. You have your mucolytics to break up the mucus. You have your vitamins, D, E, K, A. You have your pancreatic enzymes, and you also have stool softeners. So these are some medicines that you should expect them to order. All right, NCLEX practice. It says a 12-year-old client visits the healthcare clinic for a follow-up visit after laboratory and other testing. The client is accompanied by a parent. The client tells the nurse about an increase in appetite lately and about urinating more frequently than usual. The nurse reviews the client's test results and collects data from the client prior to the client being seen by the physician. The following is documented in the medical record. So we see the patient's vital signs: temperature 98.2, heart rate 78, blood pressure 118/70, respiration 16, oxygen level 96. So vitals look good. Doesn't have any pain. The skin is warm, dry, and intact. Respiratory, they do have a dry cough. They have sputum of white thick mucus following their respiratory treatments. Their lung sounds are clear in all fields. GI, they have an increased appetite. Reports taking pancreatic enzymes with all meals and snacks. Bowel sounds are active ×4. Bowel movements that are brown and fatty. They have their weight of 41.5 kgs, height of 59 inches, and the parent states that the client was diagnosed with cystic fibrosis at 3. So the question says, for each body system, click to select the priority client need to to prevent a complication of the patient's health problem. Each body system supports one priority need. All right, so then let's go to our diagnostic test. It says that the chest x-ray shows mild lung hyperinflation, no infiltrates, no atelectasis. Oral glucose test showed that the glucose was 240, 2 hours after administration of glucose liquid. All right, so let's start with the body system of respiratory. Which one is a client priority? So let's look back at the nurse's note under respiratory. It just says that they have a dry cough and they have some white mucus coming up after respiratory treatments. So what will we say is a priority? Also, that they're 96% on room air. So we would recommend PEEP for this patient. And what would PEP, which is our positive exploratory therapy, how would that help the patient? That would help the patient by loosening up the secretions. The patient does not need oxygen because their oxygen is 96% on room air. So let's talk about GI. So GI says that the patient has an increased appetite. So let's pause for a second. Do you see how I take the body system and then go back to the information that the nurse's note gave me? That's what you need to do. So the priority is based upon this patient's scenario. It is not saying, oh, what is in general. If you would do cystic fibrosis in general, it's not asking you that. It's saying the priority client need, not the priority in cystic fibrosis, but the priority in this client with cystic fibrosis. Do we got that part? All right. So GI, increased diet, and they said they're taking their enzymes, their bowel signs are active, they're there, and they have steatorrhea, right? Which is those fatty stools, and that's normal. So what will we do for GI? So priority need is pancreatic enzymes. We want to making sure that they're taking those pancreatic enzymes because those pancreatic enzymes are responsible for digesting and breaking down those our proteins and our fats in our food. So we need that. So we know that this patient needs to be on a what diet? A high calorie and a high protein diet. All right, so let's move to our immune system. So it doesn't really give us anything about the immune system other than that they didn't have any atelectasis or no pneumonia or anything like that. And our vital signs are fine. So would we put the patient on a prophylactic antibiotic, or would we use contact precautions with separation from others with CF by at least 6 feet? So we're never going to want to put a patient who is at a high risk for infections. We're not going to prophylactically put them on antibiotics. Why? Because that builds up resistance for when they do get the pneumonia or do get an infection. Guess what? They're going to be resistant to a lot of drugs. So we can't prophylactically recommend that that patient be on antibiotics. But we do want to make sure that this patient is not cross-contaminating themselves with other cystic fibrosis patients who are sick. All right, so with our endocrine system, it just says that their blood glucose was 240. What are we worried about? So will we worry about insulin administration or a human growth hormone administration? So we know that our pancreas is damaged, right? So insulin is not being produced like it should. So guess what? We're going to have to give insulin ourselves. All right? So in our integumentary, it just says that our skin is warm, dry, and intact. So what type of client need would be priority? So would they need oatmeal baths or would they need high sodium foods? All right? So high sodium foods. Why would they need high sodium foods? Because the salt is not being reabsorbed through the skin. All the salt is sitting on the skin. So that patient needs to eat high sodium foods in order for their internal sodium level to be balanced. All right? How was that question, you guys? I know that was a lot, but you see how we broke down the disease process and put it all together that we're able to answer for all body systems. All right, guys, that was today's lesson. I had a pleasure teaching you guys. I hope that you have learned something from today's lesson. If you have, let me know in the comments and leave a thumbs up and follow if you're not already following. Let other nursing students know how helpful this YouTube channel has been to you. If you think that you need more help, you think that I would be a great fit as your tutor, my information is listed on the screen. I would love to help you pass nursing school. I will see you guys in the next video. Have a blessed day.